The consortium of investigators across 6 institutions, including Wits University, UCT, African Potential Consulting, Stellenbosch University, the South African Medical Research Council, and the National Institute for Communicable Diseases, has published a new analysis of data obtained from the first national survey of female sex workers in South Africa, accessible through sex worker programs. According to Lancet HIV journal, street-based female sex workers in South Africa have extraordinarily high HIV incidence, emphasizing the need to sustain and strengthen efforts to mitigate risk and provide adequate care. Let's get more on this then. We are now joined via Zoom by Dr Jenny Coetzee, Perinatal HIV Research Unit at Wits University. Doctor, a warm welcome to you. Thanks very much for joining us here on SABC News.
It's a pleasure. Hi, Flo. Thanks for having me.
Let's start here. Let's talk about this particular study. What areas did it focus on? And, also what motivated this particular investigation? What was the reason?
So thanks, Flo. I've been working with sex workers for the last 12 years. Sorry, there's quite an echo. And what we've seen within the programs is just that their exposure to HIV risk as well as violence and mental health issues is absolutely astronomical. And so understanding from a national perspective exactly what's happening within this population in order to be able to implement effective programming is fundamental. Yeah. And one of the saddest things that we found is really that HIV prevalence in this population is 62% at a national level. It ranges quite widely between different provinces. And the incidence is obviously incredibly high. It's the same sort of levels that we were seeing in adolescent girls and young women, pre-ART, or within late survivor communities, where 1 in 20 female sex workers can expect to become HIV infected in the coming year.
Yeah. Apologies, Doctor, for that echo that you're hearing. I'm also actually struggling with it a little bit here. But I'd like to ask if there is a link between the illegality of sex work and some of the findings that you have. I ask this because I'm wondering if if it was legal, there would then be safe spaces that the sex workers could then work in. And that might mean that they'd be more protected, they'd be able to protect themselves better and be able to have agency, be able to say, I actually want to use protection. I think that in unsafe conditions, these women might not be able to have the sort of agency that they would have had they been working in safe environments. Is there any particular link that you were able to establish during this particular research?
So, I think that you're absolutely on the mark there. What we do see within research is that their vulnerability to violence is astronomical, and it's incredibly clear that this really is related to the structural factor of having sex work being criminalized. Women are not able to sell sex within safe spaces. We have research not just from this study that's published in the Lancet, but we've published a number of manuscripts as a result of this project, showing that women who are selling within venues are safer than women who are selling on the streets, which really suggests that where it's more formalized and where there are safe structures in place for women and men who are selling sex, but obviously their risk of violence is mitigated. And we do believe quite strongly that the criminalization of the profession is a driving factor in violence. We can see that there is violence not only by clients and sex workers, but by police. And what this means is that the message is very, very clear. You can act with impunity against this criminalized population. And so the continued criminalization of sex work is something that really must, as a matter of absolute urgency, be addressed within South Africa and globally.
Yeah. And of course, another thing that is concerning is that, this then filters and increases the rate of HIV throughout the population, throughout South Africa as a whole, because you might find that, some of the men that engage, sex workers might even be in relationships of their own, whether they're married or other relationships that they have, and then this kind of makes the situation worse for the country in terms of HIV infections. Is that something you were also able to look into, or was your study really limited to sex workers?
So it's an interesting question. We've in fact got data from a previous study of male clients of sex workers where we've been able to merge our data with other data, and through a collaboration with Johns Hopkins University and the University of Bristol and the University of Oxford, we've been able to establish that about 40% of the new HIV infections in South Africa are directly attributable to male clients of sex workers. Yeah. And in fact, we're currently in the process of publishing data from our latest study, our latest findings on men who purchase sex. And just not only in terms of HIV and HIV risk, both to them and to their partners, as well as into other high-risk populations such as adolescent girls and young women, but also in terms of their vulnerability to violence in adulthood as well as in childhood. So it's an incredibly interesting space to work in.
Yeah, and you know, now that you've done this particular study, and of course, you know, you've given out what you found, what then happens to it? I mean, it would be terrible if it was wasted. You know, what then happens from this point now that the study is completed and you've done the investigations? What happens next?
So our dissemination plan has been quite focused. I think the first thing was that within the national study, each site, so every province in the country had at least one site. We disseminated a report about our findings from that site and were able to advise them on various interventions that they could implement in the site. Our findings were used for the National Sex Worker Plan that's been revised, and it's also been used by various funder agencies such as the Global Fund and USAID around programming within the country. And our work with male clients of sex workers is having an equally large impact around the current draft of the National Strategic Plan and being able to advise in terms of programs for men that can really help men and help, you know, our approach to HIV to date has been really feminine. We've had a very female-focused approach, and we need to start including men and bringing men into this picture. It's their penises, it's them who need to be putting condoms on their penises, and it's them who need to be empowered to make that choice and to understand the importance of that choice, not just for the woman they're going to have sex with, but for themselves and for their families.
All right, Dr. Coetzee, thanks very much for your input. Certainly very interesting and, interesting research that you've done there. Thanks very much for giving us your time here on SABC News.
It's my pleasure, Flo. Cheers.
Right, that is Dr. Jenny Coetzee, who's the Perinatal HIV Research Unit at Wits University.